And I'm willing to stand up, even when it's hard.
The cost of health care continues to rise, as does the need for care in the poor and elderly. Our medical expert, Dr. Poonam Alaigh, is back now to discuss about accountable care organizations. Welcome, Doctor. Good to have you here.
Yes,
First, tell us what an accountable care organization is.
You know, it's really an exciting time, and when you look at the health care law that has been passed, it's over 2,000 pages. Of those 2,000 pages, only 7 pages have been dedicated to something called the Accountable Care Organization. That's a new model of healthcare delivery. It's a model where physicians and hospitals and other healthcare professionals band together on a voluntary basis and be accountable to the care in terms of both the quality and the cost that's provided to the Medicare beneficiaries.
What does that mean when you say be accountable? What is it that they are willing to do that they haven't done before?
Well, at this point, if you look at our healthcare delivery here in the U.S., it really is based on an acute care model. So it's great when you have a cold or you have allergies or you need an antibiotic, you see your physician and you get a prescription, and that's great. But 75% of mortality occurs as a result of chronic disease. And when you look at chronic disease, it's fragmented. So I go to many different, as a patient, I would go to many different physicians, get repeated testing, the providers or the physicians don't talk to one another. So when you're accountable as a collective provider community to talk to one another, to do care coordination, to ensure that you're having information systems that talk to one another, electronic health records.
So you would reduce duplicated costs.
Absolutely. The waste, the duplicated costs, the repetition in testing that goes on.
But right now, this is voluntary, and I can speak from experience just dealing with one child and so many different experts with all the different opinions. I can't get everybody on the same page. How is this supposed to work?
Well, again, this is part of the healthcare law, and just yesterday, CMS, the Center of Medicare and Medicaid Services, announced 27 accountable care organizations that have been approved, and they're functioning as of April 1. And it's a 3-year program, and Medicare beneficiaries have been are part of these accountable care organizations. They get their care from these accountable care organizations. On top of it, CMS is going to be providing comprehensive data on the overall cost of care, the experience the patients had. And so it's different.
Well, when you say for Medicare, so is this only for elderly, and do you have to sign up for this program?
No, this is the Medicare patients can go anywhere they want. If their providers belong to an accountable care organization, they're going to get care through the accountable care
So this is something your physician has to be a part of,
Exactly.
so you have to do your due diligence there.
Exactly.
Is part of this, does part of this involve what we call the digitalization of healthcare records? I mean, if doctors are going to have more interactivity, I would imagine this digital trend is going to be a big part of it.
Brian, you hit the nail right on the head. I mean, that's so critical to have electronic health records and records that talk to one another. And so there are big efforts where you're talking about health information exchanges. So it's almost like a spinal cord. You have a lot of different data sets, like your spinal nerves, that get connected to your backbone or the spinal cord. And the goal is to develop that national database, which is like your spinal cord. And no matter where you go in the country, all your records, all the key data elements are connected at that level. So that's going to be a huge piece of the success of where we're going.
What about the recent Supreme Court debate, discussion? We're waiting on a decision. How might that impact this?
Yeah, so that's a very interesting point. I mean, the Supreme Court is looking at the constitutionality of whether the individual mandate stays or not, and based on that, whether the entire law stays or whether it's only a portion of the law. But this is something that is actually a market need. One of the earlier questions you asked me was, is it only for Medicare patients? No, there are commercial payers that are now bringing providers together so that they can take care of patients like an accountable care. So whether this health law stays or not, this is the trend of the future. We have to align incentives based on outcomes. We have to have physicians and providers be in charge in terms of what needs to happen to the patient. We can't have a third party or a managed care company to be the gatekeeper and telling us what to do and what not to do.
Is this a model that's being used in other countries around the world, or is this the first in the U.S.?
This is the first approach in the U.S. It's been happening. Models of integrated healthcare delivery have have existed in the U.S., but since this is the law of the land, it's actually moving at a faster pace right now.
Dr. Alaigh, we thank you so much for taking your time to discuss and explain this.
Thank you.